My research interest focuses on exercise and physical activity and the mental health related to exercise and physical activity. Ideally, I would like to figure out how to get people to be more physically active, so focusing on those psychological and cognitive factors that predict exercise adherence, and looking at post-exercise mood, trying to figure out ways to maximize post-exercise mood so we can get people to feel better after they exercise so that they continue to be physically active and adopt that positive behavior. Well, I think especially for citizens within the state of Oklahoma, physical activity is a great behavior to adopt, because on many measures of health, Oklahoma ranks near or at the bottom, whether it is obesity, consumption of fruits and vegetables, levels of physical activity. We're near the bottom as far as very, very high rates of chronic diseases. And so we're in a state that could really benefit from good behavior change. And I think physical activity, though not a panacea, it's not going to fix everything, it's something that we can do to change our physiology. We can also change our psychology and mental health along with it. And so Oklahoma has a lot of room for improvement, and I think that's one small step that we can use to start moving in the right direction. Currently, I teach at the undergraduate level an epidemiology class, which is a class related to the study of disease and its distribution in the population. I also teach an undergraduate class called the Psychosocial Issues in Health, where we look at, again, lots of different factors related to health, stress, depression, leading an altruistic lifestyle, self-efficacy, self-esteem, all of those different kinds of topics. I also teach upper division program design class, where the students learn to create health promotion programs from the beginning to the end, where they create a program from scratch, learn how to implement it, and also how to evaluate the program. My goal is to teach students how to think critically and to have an increased level of self-responsibility. And so a lot of my coursework focuses on higher levels of thought and getting them to take the topics that we learn about in class and apply it to their own lives and try to see the bigger picture, and taking information that they might learn in epidemiology and applying it in psychosocial issues, or also applying it into another class like biomechanics or exercise physiology, another class that they might take at OSU that I don't teach, but learning how it all fits together and how it all works together, and try to create good health professionals once they go out into the workforce after they graduate from OSU. What I like about OSU is I think it's a gorgeous campus. I think it's got great school spirit. I really like the students at Oklahoma State. I find that a number of my students, a very high percentage of them, also carry part-time jobs. A lot of the students put themselves through school. They have a strong work ethic that they bring to the classroom, and I can tell that a lot of them are here because they want to be here and that they want to learn something, and I appreciate that.